You're a parasite. You're a parasite. You feed off every league. That's the art of your game. But the female insect brings disease, so why you? Because you're black lip. You have lady parts in your name. But let's put the insect aside. The truth about you and Queen, bros, we know. We put it under the net because everybody loves Cheeto. Every time she rap, black all over the body, like tuxedos. You suck off Queen's fame, so her mother brought her to my hospital. Code word, Malaria Control. What that mean? Even though what you and Queen ain't working, I still have to eradicate the mosquito.
Malaria is a parasitic disease caused by infection with Plasmodium protozoan. The most common and most deadly species is Plasmodium falciparum. The protozoan is transmitted through the bite of an infective female Anopheles mosquito. Malaria can be potentially life-threatening if left untreated. Malaria is one of the leading causes of child mortality, with 274,000 deaths of children under 5 years of age in 2019, according to UNICEF. Malaria is both curable and preventable. Sub-Saharan Africa bears the bulk of the malaria burden, with the region being responsible for 93% of malaria-related deaths globally. Nigeria alone accounts for 26.8% of all malaria cases and 31.9% of all malaria deaths globally, according to the World Health Organization. The life cycle of the malaria parasite begins when a female Anopheles mosquito transmits the plasmodium to a human host as a sporozoite, which is the infectious form transmitted by the mosquito bite. Sporozoites then travel to the liver and infect hepatocytes, where they multiply and develop into merozoites. Merozoites are released into the bloodstream, where they infect red blood cells and multiply further. Some merozoites develop into gametocytes, which can be taken up by mosquitoes during a blood meal and form male and female gametes. The gametes fuse and form a zygote, which develops into an ookinet and then an oocyst in the mosquito gut, ultimately producing new sporozoites. And the cycle repeats itself. Strategies for malaria control include vector control, diagnosis and treatment, and preventive therapy. Vector control involves limiting or eradicating the mosquito. This can be done through the use of insecticide-treated bed nets and indoor residual spraying with insecticides. Chemoprophylaxis involves the use of medications to prevent malaria. Chemopreventive methods include intermittent preventive treatment of infants and pregnant women, seasonal malaria chemoprevention, and mass drug administration. Seasonal malaria chemoprevention, or SMC, involves the administration of the combination of sulfadoxine pyrimethamine and imodiaquine to children under 5 during the rainy season to prevent malaria during the peak transmission season. SMC has been recommended by the World Health Organization and is highly effective for malaria prevention. A potential game changer on the path to malaria elimination is vaccination. Currently, there are 2 vaccines available for malaria prevention, RTSS and R21 vaccines. Rollouts of these vaccines have already started in some sub-Saharan countries such as Ghana and Kenya. Both vaccines will reduce the global burden of malaria. Other vaccine candidates in earlier stages of development, such as PFS-PZ, will also be highly welcome to reduce the global burden of malaria even further. The stages of vaccine development are explained in the link above. Watch Vaccine Doc to learn more about the RTSS vaccine. Diagnosis of malaria is mostly with blood, and it is done by microscopy, which is the gold standard, or by rapid diagnostic tests. Artemisinin-based combination therapies are the most effective medicines for treatment of malaria. Other medications such as chloroquine, hydroxychloroquine, and quinine have been used to treat malaria, despite all the methods of malaria prevention and treatment. If the mosquito can be eradicated, then there wouldn't be any more malaria cases, hence the lines.
You're a parasite. You're a parasite. You feed off every league. That's the art of your game. But the female insect brings disease, so why you? Because you're black lip. You have lady parts in your name. But let's put the insect aside. The truth about you and Queen, bros, we know. We put it under the net because everybody loves Cheeto. Every time she rap, black all over the body, like tuxedos. You suck off Queen's fame, so her mother brought her to my hospital. Code word, Malaria Control. What that mean? Even though what you and Queen ain't working, I still have to eradicate the mosquito.
For more breakdowns like this, subscribe to Med with Cred. Then, of course, go watch the full battle between Black Lip Pastor and Dr. Cardio. The link to the battle is in the description below. Till next time on Medical Barz, The Breakdowns.